Hello friends.
Hello friends, welcome to the important points about the segments. This is chest X-ray. The main reference book is Felson's. So first segments. So in the segments there are different bronchopulmonary segments in the lung. So segmental anatomy, which we are going to learn, is very important. Especially it is important for a bronchoscopy. Why? With the help of this segmental anatomy, we can identify different orifices, bronchial orifices, and if there is any tumor or if there is any foreign body which is present in any of the bronchial orifices, they can be localized and they can be identified, and they can also be removed with the help of bronchoscope by identifying the segmental anatomy. So each bronchopulmonary segment will have its own bronchus. So obviously, if we know the bronchial anatomy and segmental anatomy very well, we can identify where the lesion is, which bronchus the lesion is, and how to approach it with the help of a bronchoscopy. Now, for this, there are many disease processes which may be segmental in distribution also. Like, for example, diseases like neoplasms, pneumonias, bronchiectasis, lung abscess, tuberculosis, aspirated foreign body, pulmonary infarcts, all these can have a segmental anatomy. That means they might involve one segment and they might spare the other segment. If you see, for example, the lung abscess, which is actually a bacterial infection, it occurs most commonly in the posterior segment of the upper lobe. It most commonly occurs in the upper lobe, here in this upper lobe, and it might even occur in the posterior segment of the upper lobe. Or it can occur in the superior or posterior basal segment of the lower lobe. This we have lower lobe here, and in the lower lobe, in the posterior or superior basal segment of lower lobe, it can occur. So we have segmental distribution for some of the diseases. This understanding the segmental collapse is also important because there is a chance that a particular segment might undergo some disease process and it might be collapsed. Now, arteries of the lung are also parallel to the bronchi. So, whenever there is a pulmonary embolism or pulmonary infarction, it can also be segmental in distribution because each bronchopulmonary segment will have its own arteries. In order to differentiate between pleural and mediastinal disease, can also be helpful with the help of segmental anatomy. Whether the disease is based on pleural in origin or is it mediastinal in origin, it is also helpful with the help of, it can be differentiated with the help of segmental anatomy. So, this segmental anatomy is also helpful to understand the pathogenesis of many diseases. Like, for example, if you see bronchial tuberculosis or any type of tuberculosis, if you see tuberculosis requires more oxygen. So, apical segment of the lungs have more oxygen, that is, there is more ventilation than perfusion in apical segment of the lung. So, tuberculosis has a predilection to the apical segment of the lung. So now let us see the normal bronchial segmental anatomy. If you see the normal bronchial segmental anatomy, it varies from one individual to other individual. It is not similar in each and every individual. Like some of them might have a particular anatomy, the other might have the different type of anatomy. So these are just an examples of some of the images which will help us to understand how the segments were divided. Actually, we have nearly 10 segments were divided in each lung. We have right lung and we have left lung, and each of this lung is divided into around 10 segments, and each segment has its own bronchi. So if you see this one here is the bronchi for apical segment of the right lung. See, right lung is again divided into three lobes: upper lobe, middle lobe, and lower lobe. In the upper lobe, we have the apical segment. We have three segments in the upper lobe: apical segment, anterior segment, and behind it we have posterior segment. So apical segment is by this bronchi, which is by apical segmental bronchi. Then we have anterior segmental bronchi, which is 2, and 3, which is nothing but posterior segmental bronchi. So in the upper lobe, we have apical bronchi, anterior segmental bronchi, and posterior segmental bronchi. Similarly, in the middle lobe, we have only two: medial bronchi and lateral bronchi. So in the middle lobe, we have medial bronchi, which is 5, lateral bronchi, which is 4. This 4 is actually lateral bronchi, and this 5 is medial bronchi. Then we have lower lobe. Lower lobe is divided into 5. One, we have superior bronchi. Then there is basal segment. Basal segment is again divided into medial basal, which is B7, anterior basal, which is B8, lateral basal, which is 9, and posterior basal, which is 10. So all this is the bronchi, how they are divided, and they are each segmental bronchi will supply its own segment.